Worryingly, people who end up in the A&E, sometimes after repeated trips to their GP, are less likely to survive their disease. So, particularly if they have stomach, bowel, liver, pancreatic, lung or ovarian cancer.
Yes, well, the new study from the International Cancer Benchmarking Partnership, working with Cancer Research UK, comes after the House of Commons Health Committee warned earlier this week that cancer survival in England could actually go into reverse because of failures to diagnose the disease early as a result of staff shortages.
Yes, but at least we all put a mask on and locked ourselves away, hey? Who better to help us explain more than our next guest? It's former head of the World Health Organisation's Cancer Programme, Professor Karol Sikora, a friend of the channel, a friend of the show. Thank you very much. I mean, look, this is terrible news, isn't it, really? I mean, why can we be, what is it, the fifth largest economy in the world, something like that, and fewer people are surviving cancer than we've had before? There's something that's not right, is it?
It's difficult to explain. I mean, the report looked at cancer patients between 2012 and 2017. So it predates COVID. It predates the mess that we've been in with cancer services over the last 2 years. And it shows appalling statistics. We know that emergency presentations, that's people that go to A&E rather than going to their GP, tend to have a much worse prognosis, both at 1 year and at 5 years. And that's because certain types of cancer, abdominal cancers, lung cancers, when they present as an emergency, are much more advanced. They spread more around the body, and that makes them much more difficult to treat. So this report, which is, as I say, before COVID, shows that we weren't doing as well as other countries like Canada, Norway, a whole 12 other countries of about the same level. So something has to be done. I've been banging the drum during COVID, which clearly has made the whole thing much worse. And we've got to get something organised in the NHS to deal with people that have cancer symptoms.
To what extent is this down to doctors or GPs sort of sending people away when they come to them concerned with symptoms? Because some of the symptoms people will be experiencing, they won't be obvious cancer symptoms. They could be symptoms of all sorts of other diseases. So do you think GPs, sometimes they're almost saying, oh, you'll be fine, or it might be something else, and they're not taking the symptoms seriously enough?
Yeah, it's difficult to blame the GPs only. It's the system. If you go in France to a doctor and he thinks you've got cancer, you'll have a CT scan or the appropriate diagnostic the next day, certainly that week. Here, you may wait weeks before you get it. In 2000, I was on a committee, it was a long time ago, 22 years ago, to introduce what's called the 2-week wait, which means if your GP thinks you've got cancer, then he can refer you and you have to be seen in hospital within 2 weeks. Now, that's been a good system, except during COVID when it broke down. But only 26% of all cancers come through that route. Most don't. And the worst route to come is an abdominal catastrophe and end up in the emergency ward and have to have emergency surgery, because that means the cancer spread quite widely. So getting better diagnostics is the key to get out of this mess, and making them speedy, and use 111. 111 is actually a very good system for sorting out people that are really ill, and we could develop that for cancer. So you could bypass the GP if you have cancer-related symptoms.
Well, we could bypass,
and go straight to a doctor.
Yeah, well, obviously, I mean, sometimes you don't have to bypass the GP because they're not even in the surgery, but seriously, I need someone to blame here, right? I need someone to blame, OK? Who is at fault for this? Come on, what is the thing? Come on, I need to have a go at someone. Who is it?
The GPs are all cause us criticism. Partly patient delay, especially men. They're quite stoic in Britain. They're different from French patients. Partly the relationship of patients to the NHS. We are passive recipients of free care. We think it's a privilege to go to hospital. You're paying for it in your taxes, and that's part of the trouble. The GPs, you're right, since COVID, it's become impossible. And cancer is not a disease you can diagnose on the telephone. You have to see people, you have to see their eyes, you have to understand how severe their symptoms are. And then getting into hospital, not into beds, but to get diagnostics done. Waiting lists, lack of capacity, throwing money at it. We're all going to pay more national insurance now, supposedly to pay for health and social care. Some of that has to go to better diagnostic services. There are bits the NHS does well, and there are bits it doesn't do so well. And streamlining the cancer journey is one that it doesn't do well on.
No, but it's interesting that you said that, since COVID, it's become impossible in relation to GPs. Do they need to pull their finger out?
I think they need to have systems that allow them to pull the finger out. If we have these diagnostic centres, it's rather like a funnel. You have a funnel, patients go in at the top, and a few patients, only a few, will be found to have cancer. But you've got to screen a whole lot of people. And if GPs could access that quickly, instead of writing letters, writing reports, even emails to hospitals to get appointments, things get lost, they get lost in the post. People regularly tell me they're getting an appointment to come to the clinic in the NHS after the clinic's been and gone. But it's taken that long before they get a letter in the post. There's got to be better ways. You know, budget airlines are so efficient at keeping their staff, keeping their customers very happy. You know, I went to Lithuania 2 weeks ago on a budget airline. It was fantastic. I mean, I'm not computer literate, but even I could book the ticket easily. You try and do that on the NHS, you're not going to even get a GP appointment online now. You're going to have to phone someone up, deal with some stroppy receptionist, and haggle your way in. And it's not right that we have to have that in the 21st century.
Yeah, absolutely not. And look, finally, yesterday, of course, the 1.25% increase in national insurance came into force. This is to raise money for the NHS and social care sector. £12 billion they're hoping to raise. Are you hopeful at all that some of this money that the government will raise will actually go towards improving care? Because many people say the NHS is a black hole. The money will just get swallowed up and actually there'll be no improvements.
You know, I lived through the biggest rise in the NHS in Tony Blair's era, where the NHS was tripled. The budget was tripled over a period of 6 months, and it made almost no difference to my patients on the wards or in the clinics. Where the money goes, I have no idea. It's not that the staff are overpaid. It's not that. It's just a very inefficient system, leaky and inefficient, and abused by some people. So I think what we've got to do is really make it exactly like the budget airline model, make it customer friendly and make sure its money is used efficiently.
Yeah, so actually, just quickly, Professor Karol, every single time that we suggest some form of reform to our NHS, everyone gets on their soapbox, starts shouting about it. It's this big sacred cow, you know. We've got to, you know, and actually, so you can't even really have an educated adult conversation about improving the system that we've got. In an ideal world for you, how would you sort the NHS out?
I sort of get rid of half the management staff, get the doctors, the nurses in charge, abolish all the committees, the trust boards that are totally inefficient, and talk about things that are completely peripheral to the running of it. You know, the trouble is, as you say, Patrick, if you criticise it, as I've done, I said it was the last bastion of communism in Europe, you get pilloried by the system. You say, oh, Sikora's mad, he's talking about communism and the NHS. To make it better, you've got to do something with it. We love it. We love it because it's universal. That means it's free at the point of delivery, which is great. And we can keep that. And so is the whole of Europe. All the systems in Europe are the same. It's just a different mechanism. We've got to make it more efficient. And that's where I really spend the money, and much more friendly to the consumer, which is us. And we're paying for it.
Yes, that's right. It's not